Omicron, the new COVID variant sweeping the world, has arrived in New Zealand. The case is at the Sudima Managed Isolation Facility in Christchurch. The ominous news comes the day New Zealand achieved the target of 90% fully vaccinated, and MedSafe approved 5 to 11-year-olds receiving a mini dose of the Pfizer vaccine. Juliet Speedy begins our coverage with the latest on the Omicron case and the possible return of lockdown.
We were just getting used to living with Delta, and in walks Omicron.
We've identified our first case of the Omicron variant in New Zealand.
The first case of the latest highly transmissible COVID variant coming in through the border, straight to an MIQ facility in Christchurch.
The person arrived in New Zealand on a flight from Germany via Dubai. That landed in Auckland, and then the people on that flight were transferred to Christchurch on a chartered domestic flight.
Omicron is spreading at an unprecedented rate, according to the World Health Organization, with cases doubling every 2 to 3 days. The symptoms are milder, and while early studies show vaccines may be less effective against the variant, there are promising signs that booster shots will bolster protection.
This is to be expected, really. The speed with which Omicron is spreading around the world, it was inevitable that we'd get a case at the border sooner or later.
Bloomfield says authorities are intent on keeping Omicron out of the community, but if it did spread, the dreaded lockdown could be back.
What I would say is, even under the current framework, there is a provision for local restrictions or lockdowns, whether it's Omicron or Delta.
Michael Plank says the pace of Omicron's spread is a worry.
It is concerning just the sheer speed that Omicron is spreading means it doesn't give you a lot of time to react. It's been less than 3 weeks since most cases recorded their first case of the Omicron variant.
Cantabrians aren't panicking.
Well, I guess everyone's thought it would get here eventually.
I'm personally not too worried being vaccinated and as a younger person.
I think that it's an interesting development, but one that was bound to happen.
And the Director General of Health insists the risk of spread right now is very low.
The key point, and I just want to emphasise this again, is this person is in managed isolation, as are all the close contacts who were on the flight. So this is not a case that's out in the community.
Insisting everything's going to be all right. Today, anyway.
So, Juliet, what role will vaccine boosters play in protecting the public from this new variant?
Well, Melissa, Ashley Bloomfield said today that rapidly emerging data shows that 2 doses of Pfizer is around 40% effective against symptomatic COVID, but a third booster shot bolsters that right up to between 80 and 90%, which he says is good news because it shows it is a good vaccine. But the question now is whether to shorten the time frame between those first 2 doses and that booster shot. Currently it's 6 months. Tomorrow, government ministers will meet to discuss whether to shorten that based on advice from the Ministry of Health, to hopefully better protect the community against this new variant and also to hopefully better protect the community against any more of those dreaded lockdowns.